All right. Hi, welcome to everyone joining us this Friday afternoon for what we hope will be a probing and real conversation about emotional health and well-being. Of course, as you know, a very deeply important issue and what we at the New York City Health Department call one of the parallel pandemics to COVID. I'm Dr. Dave Chokshi. I have the privilege of serving as the city's health commissioner, and it is my genuine privilege to get to introduce Dr. Vivek Murthy, who's joining me for this conversation. Dr. Murthy is the 21st Surgeon General of the United States with a particular role leading the nation's COVID response. He also serves as Vice Admiral of the U.S. Public Health Service Commission Corps. During his previous tenure as our 19th Surgeon General, Dr. Murthy helped to lead the national response to a range of health challenges, including the Ebola and Zika viruses, the opioid crisis, and the growing threat of stress and loneliness to Americans' physical and mental well-being. He also issued the first Surgeon General's report on alcohol, drugs, and health, in which he challenged us as a nation to recognize addiction as a chronic illness, not as a character flaw. And prior to government service, Dr. Murthy was a serial entrepreneur, starting several organizations and companies connected by the common thread, at least what I think of as mobilizing people to fix broken systems. Vivek is also a husband and father to 2 children, a salsa dancer and mango lover, and I feel really fortunate to call him a friend. So welcome, Vivek, and thank you so much for the time for doing this.
Well, thank you, Dave. I'm so excited to be doing this with you, and just so incredibly grateful for all the great work you're doing in New York, and equally as grateful to have you as a dear friend. So thanks for having me.
Thank you. Well, look, we only have an hour and I want to use every precious minute of it. So let's dive right in. For the audience that's tuning in, the format will be a mix of questions that we have for one another, Dr. Murthy and I, and I'll intersperse some audience questions as well. A big thank you to those of you who have submitted them already, and we welcome more in the comments, and we'll try to take some in real time as well. For the first set of things that I'd love for us to talk about, it's about health workers, emotional health, and what I think of as shifting the paradigm of the conversation around emotional well-being and mental health. But I wanted to start, if I may, Dr. Murthy, with a more personal take on this question. How are you and your family doing? I know you live in a family of clinicians, people who have taken care of others during the pandemic. And I'm wondering if COVID resulted in any major changes to your family's daily routines that may continue beyond the pandemic.
Well, that's a great question. And Dave, please call me Vivek. Obviously, we've known each other a long time and, I'm informal. The pandemic, I think it touched all of us deeply, even though it may have touched us differently. And my family was no different. When the pandemic was just taking off in the United States, we made the decision, my wife and I, to bring our 2 kids down and have them stay in Miami with my parents and with my sister. And so we have had this unusual but beautiful extended family living experience together over the last year. And, it's been chaotic at times, confusing often, but really beautiful just to see the relationship that my kids now have with their grandparents and with their aunt. And for me also, just to have time together with my family for the first time in a way that I haven't since I left home years ago when I was 16. So all of that really stands out. I think the other thing to note is that, like many families, we were touched deeply by COVID in terms of loss. So we had family members who, and speaking of family members, is my son Tejas, who decided he wants to join the conversation. This is Uncle Dave. Remember Uncle Dave? Yeah, hi. Okay. So, and actually speaking of pandemic life, our children have become really integrated into our lives and our work as well. So like my son will join me on like most work calls, and my daughter will join my wife, Alice, on many of her work calls. And that's just, I think, a reflection of what many parents were dealing with even pre-pandemic, which is that it's not always neat and easy to separate your work life from your family. And I've just realized that there's a beauty in having, a lot of overlap there. But I should lastly just say in terms of loss, though, like, we've lost at this point about 9 relatives to COVID-19, some in the United States, some in India. But we know many other families have lost relatives as well. And it's just given us a deeper appreciation for the time we do have together. And also for the fact that in pandemics like this, it kind of resets your priorities or reminds you of what's really important to you in life. And I realized that for me, Dave, I spent much of my life living according to a set of priorities that weren't actually consistent with what I would tell you my priorities were. I would tell you my priorities were centered around family and friends, but I was really living a life that was centered around work. And the pandemic made that very, very clear to me. So part of what I'm grappling with, which is what I think a lot of people are grappling with, is what does a post-pandemic life look like? What do I want to occupy my time, attention, and energy with? Where does my family fit in? And how do I really build around my family and relationships as my top priority, as opposed to building primarily around work, which ends up making for a very, very different life?
Well, I really appreciate that, Vivek. And, one of the things that we've talked about before is the gap between one's stated values and our lived values. And trying to be clear-eyed about the fact that having that gap is natural. It's a part of human nature, but identifying it does allow us to try to close that gap. And so much of it, in terms of narrowing it, has to do with our relationships, as you just said. And
David,
I wanted to.
Could I just ask you the same question, actually? Like, how has the pandemic affected you and your family? And I'm curious if you are thinking or rethinking what the future looks like given everything you've been through.
Thank you for asking that. And the pandemic, certainly has been difficult for us in many ways, experiencing some of the same loss that you've described. I found myself both because so much of my professional life has been dedicated to the response over the last 18 months. It is always thinking about our challenges in the context of what so many other people have experienced, and frankly, how sometimes the challenges and the difficulties, as much as I may feel them, I'm particularly thinking about difficult periods back in last March and April, as well as more recently this past February when most of my family members and I contracted COVID. Also feeling the good fortune of how we've emerged in many ways, far more unscathed than other families have. And particularly here in New York City, I just think about how much grief and stress and trauma people have experienced, and particularly so for healthcare workers and public health workers, which is something that maybe we can spend a little bit more time, unpacking and talking about. I remember during the peak of the surge back in March and April, talking to some medical residents at several different hospitals around New York City. I remember visiting with them and them telling me about the heart-wrenching and extraordinary experience of having to pronounce multiple patients' times of death during morning rounds, which you and I know would otherwise be an exceedingly rare occurrence. And then after a grueling day of trying to take care of people, going back to their own families and confronting the fear of bringing COVID home, to the people whom they most loved, and waking up the very next day, and trying to do it all over again. So, this is something that, I find myself thinking about, well, have people actually had the time to process that and unpack it? And I worry that not enough people, have had that time. So, this is something that maybe I'll toss back to you to see, how how is it that we should expect, even as, hopefully we are emerging into a different phase of the pandemic, and in many ways we already have, but it has been difficult to find the time that one needs to prioritize emotional health, particularly if you're working in a profession that is in service to others. How do you think about that?
Wow, it's a really good question, Dave. And I would just say from the top that, I, like many people, struggle to figure out how to make sure I'm protecting my own emotional health and well-being and investing in it. There's a notion that it's self-indulgent to think about your own well-being and care. And especially in the midst of a pandemic like what we've been through over this past year and change, it's especially hard to think that taking time for yourself is justified or okay, with everything that's going on. But the reality is that we can only help people if we ourselves have an emotional fuel tank, if you will, that's full, or at least that is mostly full. And I'll tell you an interesting thing. When I finished my time in government last time, and I remember coming out, I was feeling pretty drained, pretty depleted. And my wife, Alice, and I remember we decided to just check in with each other each day, like at the beginning of that transition. And one of the questions we asked each other was, how full is your tank? And specifically meaning, where are you with your emotional energy today? And what we were both really struck by was how low our tanks were. Like, I remember telling her one day, I think I'm at like 10% sort of left, and that was after getting up in the morning. She was like, wow, it's really bad. I was like, yeah, I guess it is really bad. I'm feeling like really drained. But that was a consequence of going through a couple of years of work and not really paying attention as much to my emotional health and well-being. And so there are a couple of things I think that can be helpful that I've learned over the years, in part learned from people who have taught me around the country about their own pathway to developing greater emotional well-being. The first is to get rid of a fallacy. And that is that taking care of your emotional well-being takes lots of time. Because the truth is that actually it's not about how much time you spend. It's really about the quality of the time that you are spending. The second key principle is that people can be one of the greatest sources of fuel for us in terms of filling our emotional tank. And we intuitively know this, right? When difficult things happen, many of us will pick up the phone to call a friend and talk about it, or we'll get into the car and go visit someone we love. Something amazing happens. We'll often want to share it with someone. We know that people and that our relationships are an extraordinarily important buffer for stress, but also a source of joy and emotional sustenance. But those relationships get crowded out, right, in our life. And one of the things, though, that I learned over the years is that it's not, again, the amount of time, but it's the quality of time. And if you just spend 15 minutes a day where you either write to a friend, call a friend, video conference with a friend or family member, just to check in and see how they're doing, that can go a long way toward making you feel more sustained and fulfilled, even if it's a short amount of time. And related to that is the quality of the time, right? So again, how do you make time really count? Well, the most powerful way we do that is with our attention. And if you're like me, you've spent much of the last several years of your life multitasking. I remember, and I don't say this with any pride, in fact, it's somewhat embarrassing, but I remember many conversations where I was catching up with a friend, but I was also mindlessly scrolling through my inbox and then, looking at the score of the game, like on TV and the background, and convincing myself all along the way that I'm paying attention. I can multitask. But, the science is very clear that we don't multitask. We task switch, and we do so rapidly. But that means when I'm looking at the score, I'm not paying attention to my friend. When I'm looking at my inbox, yes, I might remember the words my friend said, but the nuance is lost. And often it's what's important is not just what's said, but what's unsaid. And we lose that too. So making sure you're devoting your full attention with other people, even if that means you have less time with them, that can go a long way. Because if you've ever spent 5 minutes or 10 minutes in conversation with someone where they were fully immersed in the conversation, where they gave you one of the greatest gifts we can give each other, which is a gift of our full attention, when they were open and sharing honestly with you, that 5 or 10 minutes can often be much more fulfilling than an entire hour of distracted conversation. So again, it's not about time. It's about the quality of the time. It's about our presence. And finally, I would just say this. The last thing I learned in terms of filling our emotional tank that can be extraordinarily powerful is service. So when we feel down, when we feel increasingly alone and isolated, which is what we often feel as our emotional tank drains, because we have less energy to reach out to others, we feel we get more and more into a state where we feel anxious or we feel depressed, then what can happen is we start to feel worse about ourselves. We start to feel a diminished sense of self-worth. And service is powerful because not only does it establish an immediate connection to other people on issues that are meaningful to them, but it reminds us also that we have value and light to bring to the world. And in those ways, and these are relatively simple ways, but by recognizing, again, the power of quality time and our full attention with friends, recognizing the power that service has in filling our emotional tank, and finally recognizing also the power that solitude can have, we can go a long way toward improving our emotional health and well-being. Because solitude, just finally keep in mind, solitude is not the same as being lonely. Loneliness is when it's a state of being without others or feeling like you lack social contact, and the amount of contact you have with others is far less than what you need. But solitude is a state of welcome aloneness. And all of us need some solitude in our lives, even if we're extroverts. Solitude might just be 5 minutes, right? Where you take a moment to sit down, close your eyes and breathe. It might be 5 minutes that you spend sitting on your porch, feeling the breeze against your face, walking in nature, listening to music that inspires you, listening, as I often do, to a speech that might inspire me. But however you spend your solitude, those few minutes are when we gather ourselves, when we reset, when we take a moment and feel gratitude for what's happening in our day, and feel a sense of appreciation for the beauty that surrounds us. And those can be very powerful. But all of these, whatever path you take, human connection, service, solitude, these are powerful paths to improving our emotional well-being.
That's beautifully said, Vivek. And you actually intuited our first audience question, which was about sharing some things that you've done to increase your personal resilience level during the most challenging times. And what I heard was relationships, attention, particularly tied to the most important relationships that you have, as well as solitude, which in some ways is about making sure that your relationship with yourself is prioritized and valued as it should be. If I may, I'll riff a little bit on on your answers as well, and share a bit about how I've tried to go about this, and as you very nicely did, how it's evolved over time. And for me, like you, family has been such a source of refilling the emotional tank, as you put it. As you know, I have a young one at home as well who just turned 2, and one of the things that I realized when I was spending that unabridged time with her, when I was fully in the moment, which I will admit is not as often as I would like it to be, I found myself inspired in the way that we get inspired by children because of their willfulness, because of their curiosity, because of, at least in the case of my daughter, because of her boldness, her feeling like she was going to go after something with her whole mind. And I found that actually gave me sustenance, not just personally, but actually professionally, to be inspired by those characteristics that are often so pure and beautiful to observe in our youngest family members. And I also found that meditative moments were easier to find than one might expect. I know that you and I both share trying to keep a meditation practice, but I found that things like when I was rocking my daughter to sleep, it was a chance to find something meditative and something that was more everyday. And then the final thing that I'll just share with everyone is that you and I, along with one of our friends, Sunny Kishore, we're all part of MOI. Thanks to something that you had first identified for us, which is a practice from Japan, which you will be able to speak about more articulately than I. But the fundamental notion is that you have a small group of lifelong friends who can talk about everything from the personal to the professional to the the challenges that one is experiencing to things as mundane as finances. And that has been, particularly over the last 18 months, a place where I have been able to fill my tank back up. But if you'll allow me, Vivek, I'm going to shift us a little bit to try to go back to this notion of our chance that we have to shift the paradigm around emotional health. And this includes reducing stigma related to emotional health and mental illness. And I feel that when we do this, we have to acknowledge that that so much has already been asked of healthcare and public health workers over these past 18 months. Certainly, I've been concerned about this with my own team here at the health department, where we have grieved too many colleagues who have been lost. And I'm sure your commission core has experienced that as well. And yet people continue to work grueling hours under tremendous pressure. I wanted to connect it to some data that the CDC released today that showed that during COVID, over half of public health workers reported that within the 2 weeks prior to being surveyed, they experienced symptoms of a mental health condition, such as depression or anxiety or experiencing suicidal thoughts. And among the most alarming of the statistics from my perspective was that 37% of public health workers reported experiencing post-traumatic stress disorder. This is a rate that's, as you know, 10 to 20% higher than was previously reported even among healthcare workers or other essential workers. So, the question here is, how do we take the notion which we have heard previously in medicine as physician, heal thyself, and actually use that to not just take care of our colleagues, but perhaps see an opportunity in it to model a new way of prioritizing emotional health?
Yeah, Dave, well, first of all, I so appreciate just your focus on this issue, like as a public health leader, and including the great work that you and the team at the Commissioner's Office are doing on loneliness and isolation, because these are all really part of a broader challenge in mental health that we're facing. It predates the pandemic. It's been made worse by the pandemic. And those statistics you shared from today's CDC's MMWR report, they're just deeply concerning. I mean, to know that more than half, 53% of our public health workers are struggling with depression, anxiety, PTSD, suicidal ideation. I mean, this is extraordinary. And it mirrors a crisis that we are seeing in our healthcare providers, in our medical profession, where we see more than 50% of doctors saying that they are burned out at this point. And these are red flags of the highest order when it comes to spurring action. There are a couple of things I think that are important to note here as we think about how to respond, which is that number one, we know that first and foremost, we've got to get help to those who are struggling. And that means we have to both make it available in public health settings and clinical settings, but we also have to make it acceptable to seek and obtain that help. There are too many institutions that have counseling services available, and nobody using them because people still fear that if they use those services, that they'll be marked as somehow being weak or not able to cut it in terms of their job. And that this comes down to messaging and to modeling also from leadership. The second thing that we've got to do is make sure that we are investing on the prevention side. And what that means in part is looking at the quality of work that people are experiencing, as well as the community in which they are working. What is interesting to me, and I think about both my experiences with members of our sister services in the military to people in civilian life, is that when people have a strong community around them, and when they have a strong sense of mission, it's quite extraordinary how much they're able to do. People and purpose give us extraordinary fuel. But, for many people, they're working in environments where they may not have a sense of self-efficacy. Maybe they're a public health worker in a local department, and they're being asked to do the job of 5 people, but they don't have the resources and the infrastructure and tools to really do that job and do it well. Or maybe they are resourced appropriately, but because of the nature of a polarized pandemic, they're getting threats and attacks from the public when they're trying to actually advance the public's health, by speaking as to what precautionary measures need to be taken. So, there are many things about the nature of work itself that we have to look at to create an environment that is both supportive, but also allows people to do fulfilling work. Every job has a tax, as I think of it, and that tax is the amount of work that may not feel meaningful to you or purposeful or rewarding, but you do it so that you can do the rest of the work, which does feel rewarding. And for I think everyone, they may have to make a calculation of what ratio can work for me. If it's 50-50, my tax is 50%, which means, okay, half the stuff I do I won't love, but the other half I will love. Maybe then that's okay. Mm-hmm. Everyone's got to know their limit, and being able to talk to staff members, understand where they are in their mix is really, really important. And the last thing I'll say is around culture. That we have to change, which is that, and this is a broader societal problem, it's not unique to public health, but we look still at mental illness as a sign of being broken, as something to be ashamed of. And that source of shame is really crippling because shame in and of itself is a debilitating emotion. It's a state of being that paralyzes us, that erodes our sense of self-worth, and that can actually over time turn into anger and resentment toward ourselves and others. It is corrosive, in other words. But that shame comes from how we have chosen to look at mental illness. It's not a de facto conclusion that we would look at it that way. And we have the power to choose to think about, to talk about, to look at mental health differently. But that starts with how we share our own stories, and how when leaders come forward and talk about their own struggles with mental health, that is a tremendous source of courage and power, and such a powerful example to other people. And it encourages other people to come forth and to share their story. So these are some pathways I think we need to take if we want to truly be there for our public health workers, if we want to prevent some of the drivers of anxiety and depression and PTSD that we're seeing. And finally, I just say this, Dave, we have got to, those in fact, especially outside of public health, stand up for public health workers when they're being attacked. And everyone has a role to play here. That means that social media platforms need to think about how to prevent our public health workers from being unfairly demonized and attacked, but with misinformation. It means that our political leaders need to have public health workers' backs in standing up for them, backing them up when they're making science, evidence-based decisions, even if it's not the popular thing to do. And it means that all of us in the world of public health and medicine need to stand up for each other, support one another, recognizing that this is hard work. It's work society needs desperately more now than ever, but it is hard and we cannot do it alone. We need to be there for each other, learn from each other, and support each other.
That really resonates with me as well, Vivek. And I think the notion of a part of what we need to model as the solidarity, that you described, is something that's important for us to share what feels like sometimes this insurmountable burden, that we have, but actually to rely upon the networks and the relationships that we have, so that it is spread, and we're able to use the strength of, the way that when you weave together threads, it allows us to have a stronger cloth. It feels like the same thing as what we have to do with respect to emotional health. I wanted to ask you, Vivek, to shift again a little bit, but connecting it to one of the pieces that you just mentioned, which is so much of when we talk about what needs to be done, what remains to be done when it is about emotional health or mental illness or addiction and substance use, so much of it arcs back to the idea that the reason that we're not having the honest conversations that we need to revolves around stigma. And you were, of course, as I mentioned, the first Surgeon General to issue a report on addiction. And then you launched a national campaign to address the opioid epidemic. So, you took this on in those proclamations, but we still have work to do with respect to prioritizing help for those with substance use disorders, so that it's not seen as something that should be castigated or criminalized, but actually met first and foremost with compassion. So, what are the next pages of this chapter that need to be written?
Well, it's a great question, Dave, and I certainly have a question about this. I'd love to get your thoughts on regard to New York, but I'll tell you that, more broadly, I think we have made great progress when it comes to having more open conversations about substance use disorders, particularly the opioid epidemic in our country. I think we've made significantly more investments as a country in treatment for opioid use disorder and access to naloxone as well. But I think that where we still struggle is that there's still a massive gap in treatment for people. There is still, unfortunately, like you said, a stigma in many communities around substance use disorders, where people feel like they're the result of a character flaw or they're ultimately somebody's fault. And the other challenge we have, Dave, is that we're still not investing in prevention programs. In 2016, when I published the Surgeon General's report on alcohol, drugs, and health, which looked more broadly at the substance use crisis that we have in our country, we dedicated an entire section of that report to prevention programs. And these are school and community-based programs, which are remarkably cost-effective and just generally remarkably effective in reducing not only substance use disorders, but also improving mental health, reducing criminal justice system encounters, improving graduation rates, reducing teen pregnancy, improving a whole range of outcomes that we care about, both health and economic. And again, these are remarkably cost effective. Yet, what we have found is that their investment in these programs, the implementation of them, is still remarkably sparse. And so we've got ground to cover when it comes to investing and implementing those prevention programs and continuing to close that treatment gap. But none of this is easy if there continues to be stigma around substance use disorders, which is why, the more we are able to talk about and normalize, substance use disorders, so we can think of them just like high blood pressure or diabetes, is better. And that means that people in positions of power and authority need to speak up and about the importance of them, but also, whenever possible, share their own experiences with that of their families. The second thing I think we can do on stigma is to think also about how we train clinicians, how we train nurses and doctors and others. And I'll tell you, when you and I trained in medicine, Dave, I still remember a profound stigma around the patients who would come in with substance use disorders. And it wasn't often even like a conscious thing, but you would often find that they were just treated differently, regarded differently. The source of, I should say, the recipient of more frustration when they, asked for more pain medications than perhaps, we thought they needed, or when they ended up showing up, repeated times in the emergency room for the same challenge. But the reality is, I think the medical profession has been evolving in its understanding of substance use disorders as well. And we've got to make sure that as we train the next generation of nurses and doctors and pharmacists and others, that there's a clear recognition that this is an illness no less worthy of being addressed with skill and compassion than any other illness that we may encounter. So these are just some of the steps that we need to take. But I'm particularly curious about New York's experience here, because New York had such a unique role that it played in this pandemic. It was the first, obviously, to be hard hit by COVID-19. It helped the rest of the country immeasurably to learn about this illness and about how to approach it. Unfortunately, that learning came at such a steep cost, right? Which was the lives of so many New Yorkers and also the well-being of so many healthcare workers in New York and public health workers as well. But I'm curious, as you think about the experience New York has been through, as you look at the light at the end of the tunnel getting brighter in terms of the end of this pandemic, how do you anticipate the approach to providing people with substance use disorder care, mental health care, will differ going forward? What would you like to see?
Thanks. It's a thoughtful question, and one that we are grappling with, right now. I would say a couple of things. First is that, like so much else during the pandemic, the the brutal realities of the problems that we were confronting were laid bare. In the same way that structural racism always existed, but its intersection with the virus resulted in so much suffering. There are countless other examples where COVID exacerbated the inequities, that we know people have been suffering from for years and often generations. And for substance use disorders, I particularly think about the ways in which this ties to the notion of vicious cycles in health. The ways in which people get swept up in challenges, often life challenges, whether they are emotional or social or psychosocial, and one thing leads to another. So many of the patients whom we took care of, when you started to unpack their stories, you realized it was like a series of dominoes falling. One thing happened, and then perhaps someone lost their job. Perhaps that meant their home was under threat and they had no place to live. And often, that was the beginning of the stories that led to the suffering that we ended up seeing as doctors. We don't talk about this enough with respect to vicious cycles and those compounding effects, that happen over time. And to me, they're fundamentally important when you start to think about the solutions, because it belies, the point approaches that we are sometimes too fond of in medicine to say we have a pill that will solve things, or even a miraculous vaccine that will solve things. And instead, it takes us building virtuous cycles, to help people, but to meet them in those particularly troubling times in their lives. So that's the philosophy, that we are trying to start with, and it really, aligns with what you described with respect to the approach to prevention in the Surgeon General's report. And there are a few specific things, that I'm most excited about. And first, I have to credit the Mayor's Office of Community Mental Health, which has sparked an incredible amount of investment in actually meeting these needs in the way that I described. Linking social needs with substance use disorder, clarifying that there are no bright lines between mental illness and why someone starts using opioids or alcohol, and that people come in these, as you well know, complicated and complex packages, and we have to meet them on their terms and actually have programs that are nimble and flexible enough to respond to that complexity. So one example is we have intensive mobile treatment teams, which meet people literally where they are, whether it's in a subway station here in New York City, or a shelter, or their own home, and can bring to bear whatever interventions it is that someone needs, whether it's socks or wound care or counseling, or access to treatment, to medication. And so we're massively expanding the capacity of those intensive mobile treatment teams. We're also, as I know you're concerned about, looking hard at the fact that there's more fentanyl in our drug supply, and that has resulted in opioid overdoses getting far worse over the course of the pandemic. And the key there is one of the other things that you mentioned, which is expanding access to treatment. For what we have tried to do there, it boils down to lowering barriers to accessing buprenorphine, which is particularly effective treatment. We've used telehealth over the course of the pandemic and are thinking about other ways that we can bring it even further into our mobile treatment options. And we're also using things like methadone delivery services, which was something that we were forced to innovate during the COVID pandemic, because so many of our brick and mortar sites were not functioning, to be able to actually deliver it to people's homes and meeting people where they are. So those are some of the ways that we're trying to advance this. But I think that staying true to this idea of interrupting vicious cycles in health and bringing in that prevention lens that you mentioned, those are areas where we still need to elaborate interventions that can be more effective to address those things.
Hmm.
I wanted to touch on one other thing that I know you are particularly passionate about, and you've already spoken about it a bit, which is loneliness and disentangling what we mean by loneliness and social isolation and solitude. And you've spoken previously about this, of course, and have written eloquently about it, very much informed by the experience that you had that loneliness was a common thread, that cut across demographics and geography and income. But every time you named it and started to talk about it, it unlocked, this well of interest in people. So I'm wondering if you have specific ideas that we in public health and healthcare should actually talk about it differently, should make it so that it's not just destigmatized, but actually is seen a part of our day-to-day work. To think about loneliness and social isolation and the need for connection.
Well, Dave, first, I'm so glad you bring that up, because I do think that the issue of loneliness and isolation has been a longstanding public health challenge that we're just now starting to recognize, in our conversations and our public health strategies. But there's still a long way to go. And I'll just tell you also why I've been so concerned about it. It's not just because loneliness is a bad feeling. It's not just because we have millions and millions of people in our country who on surveys will say that they're struggling with loneliness, which means honestly the real number is significantly higher. But I'm also concerned because we have now seen, through the data that people who struggle with loneliness, that is associated with bad outcomes for their physical and mental health. It's associated with a greater risk of premature death and heart disease and dementia and depression and anxiety and a whole host of other conditions that we care about. And, the interesting thing about this, though, and this is different from like many other medical conditions, is that to address loneliness, you don't need to be a nurse or a doctor, right? You don't even need to be a public health expert. You don't need to be an educator, in terms of an academic expert on these topics. Anybody actually can help, because this is about forging meaningful social connection. And so when I think about the local YMCA and the kind of community it might create when people come together to exercise or to engage with each other in other pursuits, on a regular basis, I think about community. I think about a public health intervention. When I think about faith organizations and the communities that they build and sustain in their congregations, I think about a public health intervention. When I think about workplaces as well, workplaces where people spend a third of their life or more, but places which have the opportunity either to be a place where you just check in and check out, or to be a real community. I think about places that actually could represent powerful public health interventions. And so as we think about going forward, the thing that worries me is that for decades now, what we have seen in our country has been a decline in social capital, has been a reduction in people's participation in these communities, whether it's bowling leagues, as as has been written about, in the past, or whether it is, churches and synagogues and other faith institutions, whether it's having friends over, which has actually interestingly decreased in frequency, the number of people who have friends over for dinner on a regular basis. Like, however you look at the measures of social capital, what you see, and Bob Putnam, is the icon who described this very well in his original book, Bowling Alone. But what you see is that we are somehow doing worse. And we're doing worse at a time, interestingly, when many people are feeling greater stress and greater anxiety. And I don't think that that's a coincidence. I think, yes, the modern world, fueled by social media and other technology, has created a culture of comparison and driven people to pursue wealth and power and fame in extraordinary and unprecedented ways that I think is detracting from our happiness. But one of the most powerful buffers to that kind of stress, which is meaningful, authentic human relationships, is something that people feel they have even less of. And so you put these, trends together and you see a profound challenge. But public health can address these, number one, by raising it in conversation. There's something profoundly healing about being able to talk about the challenges you have and not feel a sense of shame around them. Public health can also look at interventions that build community and look at community building as a public health intervention. We haven't traditionally thought about it that way, but it's a way in which not only can we expand in an accurate way the scope of public health, but we can also engage community members who perhaps never before thought they could be actors in improving public health, but it turns out they can be. And the last few things I'd mention is, any public health work is made better by data and analysis. And this is just a place where we have not spent a lot of resources and time doing assessments to understand, number one, what is in fact driving loneliness in our communities? What are the interventions that in fact seem to work and work well? Which people within our communities seem to be more affected by loneliness than others? And the assumption that it's somehow older people who are at greatest risk of loneliness is actually one that the data challenges, because it seems that one of those spikes that we see among loneliness is in fact among young people, among adolescents and young adults, despite their connections by technology. So these are but a few of the ways that the public health community can help address loneliness. And I think if we actually address loneliness in this way, bringing in people, helping them recognize the powerful role they can play in building community and strengthening people's health, then we start to make public health a community affair, as opposed to the work of a small group of dedicated people. It starts to become something all of us can contribute to. And that's when I think we will do well. That's when we'll ultimately enhance connection. It's when we'll reduce loneliness and people's lives will get better.
I want to pick up on that because I think you're hitting at something very fundamental here, which is, is it the responsibility of public health to address social cohesion and connection? And I think you're laying out the argument for why yes, it is, because it underlies so much of what we are talking about with respect to emotional health, but also with respect to some of the pathologies and diseases that we've talked about as well. But again, COVID has made this magnified in so many ways, and I think about the ways in which the lack of trust or the lack of cohesion have manifested over the course of the pandemic. Whether around vaccination, we are certainly grappling with that in New York City, as many places around the country and around the world are, or the polarization around questions about when masks should be worn or when they shouldn't be. And I think what it has forced us to confront at the New York City Health Department is that, okay, if we start with this idea that, yes, this is worthy of public health concern, then how do we start to apply some of the methods that we know work in public health? And as I know you are, we always are data driven, and so we want to start with the data. So I wanted to share a little bit of how we're just starting to tackle this with we have an annual community health survey where we ask New York City residents questions about all aspects of health. And for the first time in 2020, we asked questions about different aspects of social cohesion because we believe that it is connected to health. And so let me share the findings. Some of them are almost stereotypically New Yorker. So first, 66% stated that if they saw someone walking their dog and didn't clean up, they would say something to them. So perhaps that's the image that the rest of the United States has of our gruff New York ways. But 62% also said that they can trust at least one of their neighbors with a key to their home, which I thought was remarkable, particularly in a place like New York City. But a little bit less hopeful is that, and as you alluded to, only 40% said that they get together with people to discuss common issues. And I think this, belies some of what we're seeing with respect to not just polarization, but just understanding, one another's lived experiences. And so, I thought you would find those interesting, but it also, I think, pushes us to think about the interventions that we have to try to actually improve social cohesion as a matter of public health. And this is an area where, again, I think we have to be creative. We have to think about what more we can foster. But we've started to do it in some ways with our vaccination campaign in particular, encouraging people to share their stories, thinking more deeply about social networks and how they shape beliefs about health, particularly about vaccination. And I think one of our abiding lessons from the last 18 months is that so much of that is hyper-local. Even in a city at the scale of New York, you have to actually think about it in a way that is inherently very micro, that gets to the ways that people actually interact in the neighborhoods that they're a part of. So those are some of the ways that we're trying to advance this, but it all starts with what you pointed out, which is this is actually a matter of public health concern.
Yeah, and Dave, one thing that's really interesting, that survey that you shared, and one of the things that makes me think about is a couple of things. One is, while public health, I think, has a powerful role in leading in addressing issues like this, I think the point is that we don't have to do it alone, right? The public health can actually be powerful in helping convene other sectors to address this issue. So, for example, if you know that workplaces could be a powerful source of community if designed to strengthen social connection, if you know that schools could be a place where we can give kids the tools for social and emotional learning so that they can help build strong relationships from day one, if you know that how we as city workers engage with the public and have a meaningful impact on whether they feel that there are folks looking out for them, then you start to see how public health can inform how many other sectors operate. And so I think one of the jobs of public health is not only to do amazing work and extraordinary work on their own, but it's had to help other parts of government and society recognize the role they can play in improving public health. And when people know that role, I think they want to step up. The vaccine campaign for COVID-19 is actually one example of that, where what has been heartening is to see just how many organizations, Dave, have stepped up all over the country, from retail stores to restaurants, to churches and synagogues and temples and mosques, to schools and to unions and others who have said, raising their hands to say, what can I do? How can I help? Put me to work. I mean, that's an extraordinary thing, but it's happening because public health leaders like yourself and others have framed for the community that this is an all-in moment for New York, for our state, for America. And we all have a role specifically that we can play. So let's play that role. And so that larger vision, that convening power, that leadership role is where I think public health has an extraordinarily important role to play.
I very much agree. And I think that it is powerful to think about the ways in which we can leverage, the broader sectors that have been convened, because of this horrific pandemic, but extending that, beyond this moment of crisis to address what I think of as the slower moving disasters. They're no less impactful on health, but we don't experience them as a society in the same way. And we have, as has been the case so much over the past 18 months, it's hard to compare it to other experiences. So we always have to reach back, far into history to understand how to do this. And I think there's very much a lesson in the fact that, the wake of the 1918 Spanish influenza pandemic, the great influenza, was called the forgotten pandemic because there wasn't the opportunity to leverage and take advantage of the lessons in the way that you're describing. And so I think that's our chance to do things better and differently, than what has happened in the wake of crises in the past. Well, Vivek, we're almost at the end of our time, but I'm going to try to squeeze in one last question, if I may, in our last 5 minutes or so.
Sure.
And this is something that we've also touched on in a number of different ways, but it is what the scholar John A. Powell has written about and termed the circle of human concern, which is defined as the social arena within which people are fully valued, supported, and cared for. And this feels to me particularly important to talk about emotional health in the context of group identities, given how important, connection is to emotional health, but also how that connection is often shaped by the groups that people are a part of. But then, particularly expanding out that circle of human concern so that it encompasses marginalized groups, people who are on the periphery, whether it's older adults or BIPOC individuals, that is, people who identify as Black, Indigenous, or as people of color. And I have to say before we end, since both of us are men, how should we as a society consider further how to center women, given the disproportionate burden that has been borne over the past 18 months, even more so by women? So how should we take this notion of the circle of human concern and use it to elevate, particularly, the people whom we should be most concerned about, who are at the edges or outside of that circle right now?
Wow, Dave, that's a really, really good question. And there's no simple answer to it, but I do think that there are several steps we can take. And I'm going to start with the one which might seem like the most dull, but it's really very powerful, which is that we start with data, with information. Data is what allows us to see what's happening in society. And for too long, in too many corners of our countries, inequities and injustices have persisted because we haven't had the information, or that data has not been publicly available for people to look at what's really happening in our communities. So I think being able to actually gather data and share that publicly about where inequities exist is actually extraordinarily important. The second thing I think it's also really important here is to recognize that to address inequities, we have to state equity as a goal. And that seems fairly obvious, but it actually is striking how often that does not happen. Because when something is a clear, transparent metric for success, then we will shoot for that. We will make sure that we are putting resources and attention and energy to make that goal. The COVID-19 vaccination campaign is actually one interesting example of that, where President Biden has said to many of us on occasion that success in this campaign is not just determined by how many vaccines we deliver overall, but also by how fairly and equitably we distribute those vaccines. So that sets a clear goal for the team that we're not going to just track the fact that 320 million plus doses have been administered in this country. We're going to look at, are we reaching communities across the board, especially communities that have traditionally been left out. So clear goals related to equity are also an important concern. But there are many things we could talk about that would help drive equity. The one last one I want to touch on is actually not related to policy or to data, but it's actually related more broadly to how we see one another. Because the truth is that you can only legislate so much. You can only implement programs to a certain extent in terms of your ability to create a society where people all enjoy sort of being in that circle of concern, where they in fact are considered and treated as equals, and where their experience of life is such that they feel and recognize that they have worth. That can only truly happen if we change how people see one another. And the challenge that we have right now, in not just in America, but in many parts of the world, is that we are growing so fast and we are getting so quickly siloed, in part aided and abetted by technology, that we are not getting to know people who are different from us, right? One of the extraordinary things about military service is that you bring people together from different walks of life and you put them in an intense experience where they build bonds and relationships with one another. And military service is not the only place where that happens. I remember the very first nonprofit organization that my sister and I built to focus on HIV work in India and then in the United States. And we built such powerful bonds with people because we were in the trenches working 18, 20 hours a day to help build these programs and hopefully do some good in the world. But the problem is that for many people growing up today, those experiences may not exist. And what happens is then our understanding of other people comes not through relationship, but through the articles that we see on social media, perhaps through an angry speech or rant that we hear on YouTube, or through coverage, that we see in the news, which may or may not be fair coverage. So we rely on multiple other filters with flaws to understand the people in our community. And that has resulted, I think, in profound problems. It's led us to be able to more easily stereotype one another, to turn off and ignore the pain and injustice that some people have experienced in our society. It's allowed us to live separate lives, to not be a community, but to be an assortment of many individuals pursuing their individual paths. But it doesn't have to be like that. The way it changes, though, is if people create experiences that allow them to connect with and get to know others within their community who are different from them. This happens if we actually take it upon ourselves to seek out those kind of environments and opportunities. And if we do the same for our children. So, finally, Dave, just in thinking about all of this together, I think what you're ending on, this topic, is so powerful because it's a statement of values of who we want to be as a country. The reason that my parents came here as immigrants, that I'm suspecting your parents and many other immigrants came to this country, the reason they came here is they hoped that they would find a place, a nation, a community where they and their children would be accepted and judged, not on the basis of what their skin color was or the fact that they had a funny sounding name like I did, or the fact that they came from a particular caste, but they would be judged instead by their willingness to work hard, by their ideas, by their willingness to serve a community and to be a part of a community. And by and large, my family has found so much of that, and we're truly blessed. But we also know from our own experiences of racism and from the experiences of those who we've been able to learn about over the years, that so many people find that vision to be aspirational and still not fully realized in their lives. And so as we come out of this pandemic, Dave, I think we have this extraordinary and unusual opportunity to think about how we build and design a life that is different from the life that we had pre-pandemic, that is better than the life that we had pre-pandemic. And the question is, what are we going to do with this window? Because this window won't last forever to redesign our lives. In a few months' time, and whoever knows how long exactly that'll be, but people quickly snap back to the way things were pre-pandemic. But right now, in this moment where people are looking around and saying, what have I taken away from this pandemic? Is there something that I want to be different about my home life, my school life, my work life, about my community afterward? This is the time for us to have those conversations, to examine what we've been through, to think about how to design that post-pandemic life. And my hope is that post-pandemic life for many of us will involve a concerted effort to reconnect with the people that we've loved and lost touch with, but also to build new connections with people in our community who we may not have known. Because Dave, if this pandemic has taught us one thing, it's that we need each other, that we can't make it through difficult times by ourselves. We can't fully thrive when we're on our own. And as human beings, we were designed to connect with each other. We are hardwired for human relationship. This is our chance to reset and to build a path forward, to forge a path that's really grounded in human connection. And that's how we will build a stronger foundation for society, and how ultimately, I believe, how we will be healthier and happier than we were even before this pandemic began.
Well, thank you so much for that perfect note for us to end on, Vivek. You connected the dots between, as you put it, changing how we see one another, to the circle of human concern, to social connection, to emotional health, and to public health, which is ultimately about health equity and opportunity for us to all live our most fulfilled lives. So I think all that is left for me to say is thank you so much, Dr. Vivek Murthy, our 21st Surgeon General. Thank you for your leadership during this extraordinary time, this historic time. We are very grateful in New York City, and we are ready partners for charting this new path ahead. Thank you again, Vivek.
Well, thank you so much, Dave. What an honor to do this with you. Thank you for all of your leadership in New York City. And even before you were commissioner, just the extraordinary work you did caring for patients during the height of the pandemic. And so grateful that New York and the country have your leadership and example to look up to. Thanks, Dave.
Thank you. Take care.
Bye-bye.